Good afternoon, everyone. Really pleased to be here again in beautiful Rome and to see familiar faces and to connect with new people. Looking forward to telling you a little bit more about what we've been up to at Aspect and to share the story if this is the first time you've heard about us. Starting right at the top in terms of the mission of the company, what we're focused on developing at Aspect is what we call bioprinted tissue therapeutics. So these are implantable cellular therapies that we build using our technology and implant into the body to restore, replace, or essentially bring certain functions that are lost due to disease back to life. So just by way of a quick introduction into the company, so we've developed our core technology at the University of British Columbia. We span out in 2017, and since then we've been making significant progress. We've brought in over $260 million of funding to fuel our growth and development and have several years of runway ahead of us as we bridge the company from a preclinical stage to a clinical stage company. We have a phenomenal team of scientists, engineers, and therapeutic developers with over 100 people at the company. We're focused on applying our technology in metabolic and endocrine indications. Diabetes, obesity, rare endocrine indications, and liver disease are the areas of focus for us as a company. We're advancing our own internal pipeline as well as being very strategic about partnerships. We announced a partnership about 18 months ago with Novo Nordisk in the field of diabetes and obesity, and I'll touch on that in a few slides. So it's been a very busy past 18 months for us, as I mentioned, setting up the appropriate partnerships that we believe are important to our overall success, starting off with a really exciting partnership with Novo Nordisk in the field of diabetes and obesity. So this is a multi-product deal where we're working side by side with Novo Nordisk to defeat really serious diseases. We're marrying their stem cell technology with our bioprinting technology to create, again, multiple different products, starting off with a product in the type 1 diabetes space. So this would be an islet replacement therapy without the need for chronic immune suppression. Last year, we also announced a $200 million partnership with the Government of Canada and British Columbia. We're a Vancouver-based company, and so we partnered with the Government of Canada as well as the Province of British Columbia to build the capabilities and the infrastructure we need to conduct early-phase clinical trials. And so this injection of capital allows us to build the necessary level of vertical integration so that we could increase the breadth and depth of our capabilities as we move towards first-in-human. And most recently, in January of this year, we announced our Series B financing, and we're super excited to have missioned and value-aligned investors alongside of our great team working to really bring innovative therapies here in the metabolic and endocrine space over the next several years into first-in-human. So in terms of the platform technology, what we've assembled at Aspect is a end-to-end technology that we call our full-stack tissue therapeutic platform. This allows us to design these tissues in a computational setting. Then we moved into the real world where we're looking at recreating these tissues using our printing technology. And so we take allogeneic cells, we combine those with different materials that have different properties, from encouraging vascularization inside of the body to providing a level of immune protection, providing durability for these tissues so that we could implant and retrieve these tissues. So we bring all of these different material inputs and cells into our microfluidic printing technology, and then through a single step, we're able to recreate that software design of the combination product. So in a matter of minutes, we're able to create this fully integrated combination product that we then implant into the body to facilitate a functional cure for the different diseases that we're going after. So in the field of type 1 diabetes, this would be a tissue that's packed full of glucose-sensing, insulin-releasing cells that are put in an immunoprotected environment that would be put inside of the body to take people off of insulin one day is the goal. And so we're developing this technology in a centralized manufacturing paradigm, and we're building these capabilities in Vancouver to facilitate that type of a workflow. So if we double click on this technology, really what you'll see is we've enabled a multi-parameter optimization problem to really maximize tissue function. And so we have this capability to really hone into the overall design of these tissue structures. At a high level, you could see a graphical representation of one of these multi-layered microfiber-based tissues, and we have a lot of flexibility on the overall shape and the size, but really at the micro scale is where we have really unprecedented control to really hone into the biology and the performance and the functionality of these tissues. So this is one example configuration where we've loaded cells in the core in a material that is optimized for that particular cell type. So we could hone in on that one challenge of providing the best environment for these cells to thrive. In this particular example, we've loaded the core with cells that are glucose sensing and insulin releasing, or islets. And again, these cells are embedded in a material that are optimized for that one functionality. Then we introduce a totally different material that has a different function. So this is a semi-permeable hydrogel that blocks any cell-mediated attack. And so you could see a cross-section of one of these tissues looking at an individual fiber, and you could see that through CD45 staining that we don't have any immune cell infiltration into that cellular region. And then finally, we have another material in this particular configuration that has a totally different role. And this role is to really create that harmony between our bioengineered tissues and the native environment through encouragement of vascularization and dampening of foreign body response. So on that histological section on the bottom right, you could see a dotted line separating our bioengineered tissues from the native tissue, and through CD31 staining, you could see really nice vascularization around those fibers in between the gaps that we're able to design for. And so overall, we're able to really hone into those individual areas of functionality, but bring in that entire system into a singular implant that we could put into the body, but also retrieve if and when needed, which is an important safety consideration. And so where are we applying this technology? Well, our goal at Aspect isn't necessarily to create an entire organ that looks exactly like a native organ in terms of the architectural complexity, but we're looking at specific organ functions that have been lost due to disease. And then we look at what are the particular cells that could deliver a therapeutic effect and how we could combine those cells with our technology to implant a tissue that provides a functional cure. So that naturally takes us down the areas of metabolic and endocrine indications where we're isolating specific functions and creating rationally designed products that could be implanted into the body to replace or restore that functionality. So a great example of that is type 1 diabetes in the endocrine space, and I'll highlight a few other areas in the endocrine space that we're focusing on, but also liver. Liver is an area of focus for us where the liver is responsible for over 100 different functions, and many diseases are associated with the loss of one or several of those functions for a short period of time or for the entire lifetime of the patient. And we're looking at using cells to replace those different functions and bridge to recovery, or bridge to a transplant, or provide a satellite tissue organ that again is restoring that functionality that is lost. So starting off with our endocrine platform, and so what you could see on the left-hand side is just a visualization of one of these multi-layered microfiber-based tissues, and we're developing this endocrine platform to really support the integration of different cells that are capable of sensing the environment in terms of certain signals in the body, and then in response, we could produce the appropriate level of hormone to restore that feedback-like mechanism that is lost in disease. And this would be the only way to solve this challenge using this cell therapy-based approach. And so, of course, using hormonal replacements or taking exogenous sources of the hormone solves one aspect of the problem, but there's really no way to replace that biological sense and release function without using cells. And so our goal is to, again, use a cellular approach to restore that feedback mechanism. And there are many applications where this is applicable, whether we're sensing glucose and releasing insulin, or sensing ACTH and releasing cortisol in the case of primary adrenal insufficiency. I'm sure everybody here is familiar with diabetes, so I won't focus on that today, but I'll highlight a few of the other areas that are really exciting to us and we're advancing towards a clinical evaluation. So one of these areas is a disease called primary adrenal insufficiency. So this is a rare disease, so it's less than a couple 100,000 patients. Specifically, it's about 50,000 patients in the US. In healthy people, when you're exposed to stress, your hypothalamus releases CRH that then sends a signal to your pituitary gland, which sends an ACTH signal to your adrenal gland and produces cortisol. So cortisol is a critical part of this feedback mechanism. It's a negative feedback loop, and you can't live without it. And patients who are living with this serious condition have an adrenal gland that is not functioning properly. So they're unable to produce cortisol. So they have that ACTH signal intact, so that your brain is being exposed to stress, is understanding that, is producing ACTH, but they don't have an adrenal gland to sense that signal and produce the appropriate level of cortisol. And so these patients have to rely on exogenous sources and glucocorticoids, which come with a very big daily burden, but also are subject to adrenal crises, which could be a very life-threatening event. And so our goal here, similar to what we're doing in type 1 diabetes, is we're bioprinting an adrenal tissue that is then inserted into the body, and those cells, those adrenal cells, in this case, sense the intact ACTH signal and is able to respond with the appropriate level of cortisol to, again, restore that feedback mechanism. So what you could see on the right-hand side is data from in vivo studies. So these are studies that demonstrate efficacy of our tissues in adrenalectomized animals. So these are animals that have had their adrenal glands surgically removed. On the right-hand side, the red arm of the study is a cell-free control, and so you could see no levels of detectable cortisol. And then on the left-hand side, the blue arm is where we have our cell-based adrenal tissues. So we have a basal level of cortisol that we're able to detect in these animals, and then when we stimulate them with ACTH, we see a spike in cortisol levels to the level that is clinically relevant. So it's showing that we're able to, again, demonstrate efficacy, and we have that sense and release functionality that you're unable to recreate without using a cell-based therapy approach. So we're quite excited about this. Another area that we're advancing is in a disease called hypoparathyroidism. So this is a rare endocrine indications. It's one of the larger rare diseases. And most of the cases that result in this disease are because the thyroid is accidentally removed, and the end result is patients are unable to produce parathyroid hormone, which is critical in calcium level regulations in your body, and having inappropriate calcium levels could lead to many issues, including renal failure. And so again, using that same endocrine cell platform, we load our tissues with parathyroid cells. And on the right-hand side, you could see data from, again, animal studies. In this case, this is a functional animal study, so it's not an efficacy study. So on the right-hand side, you could see, again, the red arm of the study is a cell-free control. We have no detectable levels of parathyroid hormone. And then on the left-hand side, the blue arm of the study is the arm that has our cell-based parathyroid tissues. And what you could see is we have a basal level of parathyroid hormone, and then we have an EGTA-induced calcium reduction. So we give the animals EGTA, that reduces the calcium levels, which in turn result in our tissues producing parathyroid hormone. So again, we're able to validate this functionality, this responsiveness of our tissue, which is again something we're really excited about. I certainly want to highlight our team. It's easy for me to stand up here and share all of the exciting work we're doing at Aspect, but they're really behind the amazing breakthroughs and the exciting science and development that we're conducting. We're also actively hiring, particularly in the areas of development and on the clinical side. So if you're interested, please talk to me. That is an area of focus for us, and we have several job posts online. And then in terms of our facility, we're very much fans of vertical integration and making sure that we have all of the different aspects under one roof, and that's a picture of our new facility. It's a state-of-the-art facility with lab space and manufacturing space that we're building in beautiful Vancouver, British Columbia. So lastly, to bring it all together, really what we built that aspect is a broadly applicable platform technology. We're applying that to multiple areas in the metabolic and endocrine space through this landmark partnership with Novo Nordisk. We really validated a lot with regards to our technology, but more importantly, we have a real shot at making a big difference on the patients that are counting on us. And we're really focused on building this vertical integration to give us the efficiencies and the control to have a clinical impact in the not so distant future. So that's, thanks so much. Wish you a great end to the conference. And I know I don't have enough time for questions, but happy to connect offline. Thank you so much.